Today, we're talking about something that can feel overwhelming, but is so important to plan for: finances and family caregiving. So stay tuned and we'll get into it. Hi, Dr. Lakelyn here. Welcome to Caregiver Chats. I'm a gerontologist and caregiving advocate for Home Instead, an honor company. I'm so glad you're taking the time to join me. These conversations are a space for learning, reflection, and support. And I invite you to subscribe to Caregiver Chats on Apple, Spotify, or wherever you get your podcasts. And don't forget, I love hearing from you. You can email me anytime at caregiverchats@homeinsteadinc.com. Managing money while caring for a loved one isn't just about budgets and bills. It's about making decisions under stress, balancing priorities, and protecting your long-term stability. Whether you're navigating job changes, medical costs, or planning for care down the road, financial stability can be a powerful source of peace. Joining me today is Danielle Miura, a certified financial planner, tax professional, and former family caregiver. She's also the founder of Spark Financials, where she helps women navigate life transitions with financial clarity. Danielle combines her personal caregiving experience with her professional expertise to empower others to make confident, value-based financial decisions. So let's dive in. Hi, Danielle. Welcome. I'm so glad that you're joining me today.
Thank you for having me. It's been a blast listening to the other podcast episodes, so I'm really happy to be on here.
Oh, thank you. Well, I have come across your work. What you do, I think, is so unique, helping caregivers with their finances. There's not a lot of people in the industry doing that kind of work. And so I was like, I need to chat with Danielle because finances is a question that comes up so often from family caregivers. And I know that you kind of entered this space because of your personal story of kind of being a sandwich generation caregiver. So do you want to just briefly tell us a little bit about that and how you got started supporting caregivers and their finances?
Yeah, thank you so much for that introduction and headway into the conversation. I started as a financial planner who was looking kind of where I wanted to specialize and where I wanted to niche and who I wanted to serve. And I was moving closer to home like many people did during COVID. My grandmother fell on tile floor about a month after I moved closer to family.
Oh, wow.
And that was, I say the tile floor was the mean guy in that that started my caregiving journey. And I was a sandwich generation caregiver. I have a 6-year-old daughter, and my grandmother was 88 at the time I started caregiving.
Wow. I mean, the sandwich generation, there are so many people that are falling into that category. And I think what makes it so, well, there's a lot of things that make it challenging, but one of the elements of that is the financial piece, because often, you're raising your own family. Many people are working or navigating their careers, maybe at a very pivotal time in their earning history. And then they have this caregiving role. And so I can imagine that you maybe felt kind of those strains in your sandwich generation caregiving situation. And so I'd love to hear from you, kind of your perspective. What are some of those strains that the sandwich generation feels from a financial perspective?
Yeah, I was 25. I was kind of the rarity of the research studies that I was very young when I started my caregiving journey. And so caregiver who? Like who is that? What is that? I had no clue. It wasn't until I started actually caregiving for multiple people and started burning out that I started to realize, well, maybe this isn't just family member responsibility. This is much more than that. It was a very lonely process of being specifically a young caregiver, raising a daughter at the same time. There's not many of us that exist, even though we do exist. And on top of that, caring for a grandmother, usually that doesn't happen. Usually it's a parent. So I definitely felt like kind of like in this category of loneliness because there wasn't much support available or much people reaching out to me with similar experiences. Like I would talk to my friends and they're like, caregiving what?
Well, yeah. And a lot of people don't identify as a caregiver. They just see that they're being a helpful daughter or granddaughter, that family member that's stepping up to just do a little bit more. But then, as you mentioned, sometimes a little more turns into a little more, and then you do reach that burnout point before you know it. And all of a sudden you're like, gosh, there has to be someone out there that can help me. And so was there any kind of pivotal moment or helpful resource that you came across in your caregiving journey that kind of was a turning point or a glimmer of hope for you?
I think it started becoming more going on social media and seeing other people, influencers that were able to connect me with resources that I needed. I started going, as I was starting to dig into the space myself as a financial planner, I was like, why don't financial planners talk about this? As a research for myself, I researched all pretty much the very slim research studies that exist on caregiving and finances. And I was like, this is way too small. And I don't identify myself with these research studies because we are so few of the caregiving population. And I started going to like caregiving groups and caregiving counseling. And that really helped. And that really started to make me feel like, at least I'm not the only one going through this, that there's much more of us that exist.
Yeah, that point when you do realize I'm a part of this larger group of caregivers, I think, and getting connected. And I love that social media is a place where people are starting to connect. I mean, that's how you and I connected and how I continue to follow your work. And I think that, that's where a lot of people go to get information and resources. And so I'm grateful that you are one of the few that are kind of diving into this space. And as we've gotten to know each other a little, I thought it was so interesting. You talk about caregiving in terms of finances in kind of 3 phases. So would love for you to share more about that because, just like so much of our lives, you don't just plan once for your finances. You don't just plan once for your aging journey, which some people aren't planning at all. And that is a podcast topic for another day. But you don't just plan once for, your kids getting ready to go to school for the year. It's something that you need to continue to do over your life course. And so from a caregiver's lens, Danielle, would you mind just talking about those kind of 3 phases and what you commonly kind of see happening in those 3 phases as it relates to caregiving and finances?
Yeah. So as you messed upon, I wish it was just financial planning was so easy that we could just plan all our life plan at once and that our lives never change. Wouldn't that be awesome?
Right. But it might be a little boring.
Maybe. However, that doesn't happen for most. Didn't happen for me and my husband, and my family. I categorize as this is based off my experience. This is not like published research studies, but I categorize into 3 sections. And that's before caregiving, in between caregiving, and after caregiving.
Yeah, I think I think it's so interesting how you kind of bucket those because when you're, before caregiving, a lot of times people don't know that they're going to become a caregiver. So that's like kind of, maybe routine care, financial planning. And then when you're in the thick of caregiving, I can imagine how stressful it is. You're really just trying to go take it day by day, find the resources that you need, find the resources, financial resources to cover those needs. But then oftentimes your caregiving journey comes to an end one way or another, and you do have to kind of move forward. And what does caregiving look like from a financial perspective doing that? So if we maybe start with kind of that first phase, if somebody is listening to this and they're not currently a caregiver, first of all, we're so glad you're here, even though you're not caregiving yet. But what are some of the things that maybe people should consider, in their early planning before they even become a caregiver? Are there any kind of documents or any resources they should tap into in that phase?
Yeah, I think I'm going to make an easier example for those who've never experienced caregiving. And I think, Lakelyn, you may resonate with this as well. When you're preparing for a baby,
yes,
you're getting all the baby clothes. You're making sure that they have a crib. You may be looking into FMLA. You may be making sure that your health is in order. You want to make sure that you're going through all the proper procedures. You're having a plan in place to prepare for that baby to come home. Maybe you may be looking at what if scenarios of what if this baby doesn't come home right away? Maybe it needs some NICU. What if I don't have the financial means to take care of the baby? What resources that I can go to help provide me with support? So usually why I say it like that is because usually people don't associate themselves with caregivers. So they may resonate with them as being a mom or being a new parent, or maybe you've seen somebody else become a new parent. So you know what the process looks like.
Yeah, I think that's such a good analogy because there are a lot of books out there on, what to expect when you're expecting. I'm currently expecting our second baby, so this is very, very relevant to me. And so from a caregiving lens, I would imagine, even if we don't know if we're going to become a caregiver or not, having conversations within a family unit could probably be very helpful. Putting documents into place like powers of attorney or wills, especially financial powers of attorney, just starting to open the door for conversation, just so that when a crisis occurs or if a crisis occurs, that you're not starting completely from scratch and you're not making a lot of decisions out of haste or whatnot. So any other of those kinds of tips that you would share?
Yeah, so making sure you have an emergency fund in place. Even if you don't think you're going to be a caregiver, it's always good to have some reserves in the bank in case something happens, even if that's as small as you got a flat tire tomorrow. As you said, making sure you have your legal documents in place, making sure you're going for your annual doctor's appointments.
That's key. And that's not something you would associate really with your finances, but that's such a good point because it could impact your finances down the road. Sorry to interrupt.
Yeah, so we talk all in our industry about health is wealth. So you never know what you're going to prepare for down the road, making sure you're getting your annual doctor's appointments, making sure you get your dental appointments in, and making sure you're covering your own long-term care plan. Many caregivers are within that 40 to 60 age range, caring for parents. And so if you haven't created your own long-term care plan, you may not know how to help somebody else with their long-term care plan. So start with yours first.
That's a really good point. And I think, for many, we automatically through many employment opportunities get, 401k access and those kinds of things. And if you're planning for your own, hopefully that will then set you up for success down the road when you need that care and support. So those are such great tips on, that kind of pre-caregiving phase. I would love to move now into like that active caregiving phase. So many caregivers are, managing the day-to-day costs. And a lot of times there's kind of some of those hidden costs that come up. And, there's been various research studies, somewhat slim, as you've mentioned, but some say, caregivers spend on average up to $7,000 out of pocket on the care of the person that they're supporting. And for long distance caregivers, that can mean even more. It's probably a conservative number. I've shared that at several presentations, and caregivers will come up to me after and they say, 7,000, that's a little low for what my experience has been. So I know that's just an average, but that's a significant amount of money when you're thinking about planning for your finances. So anything that those active caregivers should be considering from a financial perspective?
Yeah, usually when I think about that AARP study about out-of-pocket care costs, the first thing I think about is that the study was done in 2021.
A while ago.
So if you're just thinking about the increase of inflation of just regular healthcare costs at 5% per year, and long-term care costs increasing by about 10% per year since that time frame, you can just only imagine how much more those out-of-pocket costs are. But yeah, I just think like COVID has changed so many of our research studies. It's almost, I hate to redo all those ones again, but it almost feels as if we have to. But going back to what you said about in between caregiving is understanding what resources are available for you, even if you don't need it. Making sure you're having an exercise routine. And maybe a therapist or someplace that you can go for communication and support. For me, it was an online group that was easy to chat via Zoom. I later transitioned into doing one-on-one therapy sessions, and that worked out really well for me during burnout. But just having like a go-to, what is your backup plan if you get burned out?
Mm. Yeah. And so often caregivers get there quicker maybe than they expect. And I think too, I love that you mentioned look into resources, even if you don't think you need it yet, because you might find, okay, maybe I will tap into a few of these resources, and then it maybe could decrease the chance that you're going to reach burnout. And sometimes those resources do require some financial commitment. Maybe it's paying for in-home support or, pardon me, as you mentioned, even, kind of talk therapy sessions that might come at a cost. But if you look at the long-term benefit of helping you sustain your caregiving role, sometimes you just have to reframe the expense a little bit. But those are certainly things that are important to look into to help sustain you in that role. Because for some people, it might be 6 months. Some people, it might be 6 years. We know some caregivers have been caring for 20 years, or you might, like maybe similar to your situation, you've provided care for multiple people in your family over the course of a number of years. And so I think it's important for caregivers not to only focus on the here and now, which of course is so important, but think about it a little bit long term, because you never know how long a caregiving role might last.
Yeah, and that's why it doesn't hurt to go through what if scenarios of what if I need to take time off of work? What benefits are available to me through my employer? What government resources and benefits are available to me? Because you don't want to be at burnout trying to find time off of work at last minute. You want to make sure it's planned out so you know what resources are available to you. There's also a lot of research studies, and I'm sure Lakelyn, you can attest to this, of care worsens during caregiving. My health worsened during caregiving. So making sure you're revisiting annually your health insurance. You may want to get higher coverage to cover some of these healthcare costs that are associated with caregiving.
That is a really great point that I hadn't really stopped to consider. Is you're right. We see caregivers kind of put their own health on the back burner, and they start to develop a chronic condition or two, or have their own health issues. So looking at your health coverage options, what a great kind of piece of your financial puzzle that you should be evaluating kind of in that active caregiving phase. And then are there any kind of unrealized or like hidden costs of caregiving that seem to surface in the work that you do that maybe caregivers aren't expecting, or they always seem to catch the caregiver off guard? I think that would be helpful in maybe preparing our listeners just to start thinking about the potential costs associated with kind of these hidden fees or whatnot that come up.
Yeah, there's so many. I'm just going to list some of my personal ones that occurred for me. Copays for doctor's appointments, copays for therapy visits. For us, it was gloves. For care workers, it was wipes. It was care equipment. If you have a lending closet for care equipment near you, I would search there first for free equipment or used lenders, because that can be free. But a lot of us, it was just like the simple things that would add up that would make a big thing. It's like, I remember when I was getting diapers for our daughter, and we were determining how much per diaper it would be. And at that time, I think it was at the most like 10 cents per diaper. But that was also 6 years ago. I'm sure it's different now. But then I was getting adult underwear for my grandmother, and that was like $2 or $3 sometimes per underwear. And you're thinking, this is a huge difference. I know obviously babies and adults are a different size, but I was like, these small things can really add up and be substantial cost for the future. And it's your decision how you and your loved one or care recipient wants to divvy out those expenses, and who you look to for support to help pay for those, because it's not cheap.
Yeah. Oh, absolutely. And you're right, especially if those are things that you're ordering on a regular basis, then those costs can certainly add up. And it's sometimes hard to balance, the cost of prescriptions and the cost of supplies. And so I like that you brought up, having a good understanding within maybe the family unit or whoever's involved in the care, who is going to cover what costs. I think that that's a hard conversation for families to sometimes have, but very necessary just to make sure that, expectations are being set, or maybe there is a family member who lives long distance who can't be there in person, but would be happy to cover the costs of some of the supplies or that sort of a thing. And so having those conversations, I think, would be really, really important for families to do on, and kind of revisit it, just like we've been talking about, as maybe the needs of the individual change or the needs increase and the costs are increasing. Revisit those conversations regularly.
Yeah, and I love how you mentioned that. You can think about maybe right now, my care recipient doesn't need that much care, but it may increase over time. So are we covering for those costs that may increase over time? As we talk about Alzheimer's and dementia, we think about the early, middle, and late stages, and care cost increase exponentially, and so does their need for care. So are we thinking maybe our loved one is in the early stages right now? Are we looking at those middle to late stages of those diagnoses and how it may impact not only us, but our care recipients?
Yeah, and I think it's so important to plan ahead for those early, middle, and late stages of Alzheimer's disease or any kind of chronic condition, because we know Parkinson's has kind of a progressive nature. And so when you have those type of diagnoses, I think it's helpful to plug into associations that are related to those diseases, because sometimes they have resources. And I know there is so many other resources that people can look into, whether it's like geriatric care managers or, as someone maybe needs to look at, home care, working with home care specialists, but then also if community living is needed, we're seeing more companies that are helping families navigate finding community living and the whole financial side of what that looks like. So I think as more people are stepping into these roles as caregivers, we're seeing more resources come about, but not everybody knows about them. And so that's why it's great to have people like you on here sharing with us about these phases and what to think about. Danielle, tell us a little bit more about things people should be thinking about in this third phase of caregiving. Caregiving has come to an end, and there's a lot of probably logistical things to handle, emotional things to handle. So from a financial perspective, what are some things caregivers should prepare for?
Yeah, so I talk about estate administration. It's like the ugly word that creeps on you once your care recipient passes away. And that can usually be a process that lasts a long time. And usually that's not an available time for caregivers to really process their grief and their emotions because they're usually doing the estate administration. Usually the person who's the power of attorney usually ends up being the executor. So it's usually, even though you want that time to be rebuilt and think about your identity and think about who you are as a person, it may not be that time because you're worried about estate administration. You're worried about closing a trust or transferring assets to somebody else.
Yeah, and that's not something we really talk about often, is after somebody passes, there's a lot of logistical things that need to take place. And I think that you made such a good point that it might not really allow you to grieve just yet. And so the grief might hit you later down the road when you finally feel like, okay, I've closed all those doors and I finally have time now to come to terms with my emotions. And then I'm sure too, so in some caregiving situations, people have been sacrificing a lot in terms of their personal financials of maybe stepping back from work or, that $7,000+ a month they were spending on caregiving. And so just kind of probably also, I would imagine, Danielle, it's helpful to just kind of refresh on what their financial picture looks like, and what their financial future looks like.
Yeah, exactly. You're rebuilding the foundation you had before caregiving. And that may look totally different. That may be, maybe you discovered something about yourself that you didn't know before. Maybe that's you want to start a new career, or you want to get more education, or maybe you retired early and now you really don't want to retire. It's now you have more options than you did before, and it's that rediscovery period. If you're working with someone, make sure that they're revisiting your goals with you, because you may be a totally different person. This sounds terrible, but a totally different person than when you first started caregiving. For me, it was 3 years difference. So a 25-year-old and a 29-year-old, about a 29-year-old, if I can count, is what it was. And so revisiting who I was at 29 is much different than who I was at 25 getting into the caregiving realm. Maybe like us, maybe we were inspired by the caregiving industry and wanted to make an impact.
Yeah. I think that is a great point. And I hear many caregivers say, I have grown a lot through this caregiving role. While it was the hardest thing I've ever done, I now realize I'm a lot stronger than I thought I was, or I have these new skill sets that I can apply to a second career, or going back into the workforce. I have these new skills, or I have this new passion and want to pursue kind of a new career path. So I think that is, some helpful encouragement to caregivers that, take the opportunity to kind of go through that rediscovery process and kind of ground yourself in, okay, where am I now and what do I want my future to look like post caregiving?
And it's also a time to revisit what your finances look like. Did I dip into savings in order to care for my care recipient? If so, how can I replenish that savings? How can I rebuild myself now for the future that I want it to look like? And how can I prepare for my soon to be caregivers? A lot of people say, I don't want to be the burden to the next generation, or I don't want my children to experience what I experienced as a caregiver. If so, what are you doing and what are you putting in place so that your children, who will any way possible be your caregiver? It's just a reality. Someone's got to take care of you. So who's going to do it? And I'm sure we'll talk about that more towards the end of our episode, but making sure you're protecting yourself for the future, for the years that you have still left.
Such great advice, Danielle. And yeah, we do have some commonly asked questions that I know you get a lot that you had given me ahead of time. And I want to make sure we make time for those because, again, we do get so many questions about this, but I'm grateful that you kind of went through those 3 phases and help us understand how finances really impact caregiving at those various stages of life. And so, you had just mentioned draining savings during your caregiving journey, but one of the frequently asked questions is, how do I not do that? How do I manage caregiving expenses so I don't have to drain my savings, or I don't have to max out a credit card? Any tips or advice for caregivers struggling with that question?
So I'm sure a stranger, someone who doesn't understand caregiving, would probably say, make sure you put your mask on before you go help somebody else. But I'm sure you've heard that phrase, Lakelyn.
Yes.
Or prioritize yourself. Well, in caregiving, that doesn't always work that way.
Yeah.
It doesn't. Finances mesh, emotions mesh. Sometimes dipping into savings is the reality. It's just what it's going to be. But what I would say to those people who are thinking about dipping into their savings is, 1, have a plan. So if you're going to dip into savings, how can you replenish that money? What can you do after caregiving, or what can you do during caregiving to replenish your savings? Maybe that's doing a new skill. I always tell people there's got to be some time that you're relaxing, that maybe you're waiting for a care recipient while they're sleeping during the day, or maybe you just have TV in the background and you study something. You watch a YouTube video and you build up your skills. there's opportunities in which you can make money and develop your skills, even as a caregiver, even if that's from home, even if that's self-employed, even if that's just doing something once a week for an hour, something that's yours that can be made money. And then the last step is know your limits. For us, I knew I couldn't do caregiving for more than 3 years. My husband and I kind of set that limit for us. I'm grateful that it was like 2 years and 9 months or something like that. So we didn't hit that 3-year mark. But that was our financial limit, that we knew that we could contribute this many years financially while dipping into our savings. But after that, we could not contribute. And what was the plan in place after those 3 years were up?
I think that those tips are really great, and putting that limit or that boundary, it might be challenging. But to your point, I think for some can be helpful to have that as a future kind of endpoint that kind of spurs the conversation for future planning too. Or reshifting some of the care responsibility within the family unit and when you come to that boundary point. And I think also another commonly asked question that maybe kind of goes somewhat hand in hand with that is, how do I even go about estimating the cost of care and how much it will cost? Because if you are trying to set those boundaries or limits, how can somebody kind of go about estimating the costs so that they can plan ahead?
Yeah, so many financial planners use what's called the Genworth study. And
Yes, that's a good one. We can link to it in the show notes.
Yeah, so we use that as a basic overall average of the cost of care. Obviously, that is not specified towards your care recipient's needs. So a lot of the hidden costs that we talked about earlier in the episode are not going to be on there. A lot of, maybe they're depending on an Alzheimer's or dementia diagnosis, those increases of care needs may not be on there. So if you want the most specified amount that you can get possible, work with a geriatric care manager to assess needs and cost of care. The second way you can go about it, if you don't have a care recipient, maybe you're planning for your own long-term care plan, is interview communities near you. Interview them, get a tour. Sometimes they'll give you a free lunch while you're at it, and get a tour of the place and ask what the costs are. That will give you an idea of what kind of community do you want to live in. Maybe you don't want to be in that care community in your city that smells bad. Or maybe you don't want to be in that community that serves okay or average food. Now is the time to explore which ones you like and which ones you don't like, so you can tell your children, these are the ones I definitely don't want to be put in. But if you do have to put me in a community, these are the ones that I feel comfortable with. You can do the same for care agencies. You can ask them what their policies are. How will someone care for me? What is the level of care you can provide? And what is the cost per hour? So you can start calculating it based off of your location. However, if you have to be that person who, I'm from California, so if you happen to be that person who is currently residing in California and moved to Texas, the care costs are going to be dramatically different. Or if you move from California to Alaska, which is one of the states with the highest cost of care, it's going to be dramatically different. So just know that if you prepare now for one city and you move to another city, it may change.
That's a great point. And I think that Genworth cost of care study is great because you can drill down by zip code, but the most effective way also is just kind of doing your own research and trying to calculate those costs. And we don't have a crystal ball, so we can't predict the future. I wish we did, because how much simpler would life be? But, it's important to at least, have that general, idea of what it's going to cost, and then allowing yourself to plan ahead. And I think also, I love that you brought up communication with your adult children. Hey, this is what I would want, or I wouldn't want. And another commonly asked question is, how do you talk with your aging parents or maybe the siblings in your caregiving situation about the finances related to the caregiving, because these family conversations can sometimes be challenging. So do you have any kind of common, maybe conversation starters or tips to make these conversations more approachable?
Yeah, I will first say when I was probably maybe less than a year as a financial planner, I had these conversations with my parents. And it didn't go over the way I would have wanted it to. I won't blame it on being young, but I'll just blame it on inexperience of having conversations with your own family members. So the things that I learned from that was planting seeds. Don't do everything at one time. You're planting its bits of information each time you talk. Don't plan those conversations at 7 or 8 o'clock at night after you've all drinking wine at the dinner table. So don't do it on Christmas. Probably not a good day.
Yeah, probably not.
Select your time in which you feel is most appropriate to have those conversations with your care recipient. Do it in a time where you've already set an agenda of what you want to discuss and what you hope to plan to discuss in the future. You could be as easy as Danielle Miura on the podcast said that we should start having these conversations. This is what we're going to cover today. And here are some of the questions I have. Or you could say, I recently saw a research study from a news article that caregiving cost, caregivers have $7,500 of out-of-pocket cost each year. Have you thought about that? Or you could say, my friend put her mom into a care community, and that was really tough for her. Have you thought about moving into a care community? So there's ways to spark the conversation to kind of figure out their wishes in a way that is respectful, but also gets you a little seeds of information that can lead to something bigger.
I like that. The planting of seeds. So it doesn't have to be this dramatic sit down, definitely not after glasses of wine at Christmas dinner. But just, as things come up, or as you yourself are thinking of these things for your future, I think asking your parents or whoever is involved in the care these questions, that's certainly a helpful tip. And one last question that we have time for today would be, you mentioned working with financial professionals. And so what should individuals be looking for, or what questions should they be asking their financial advisor? Or if they're looking for a new financial professional, what kinds of things should they consider?
Yeah, I would love to share an article that I wrote that might be helpful for your listeners. But I'll just, in brief summary, caregivers do have financial challenges that a lot of other groups do not have. If you're coming to a person and all you're doing is retirement planning, but they're not planning for you, for the potential of you being a caregiver, or they're not understanding what it's like to be a caregiver and how that affects money, then they may not be a good fit for you. You may want to come into those, interview a couple people and ask them, I'm a caregiver, or I may be caring for my parents in the future. How have you helped clients do this? How will you help prepare me for this to occur? I'm in the midst of caregiving. How can I lean on you as a resource so that I don't have to do this alone? And then the second thing I would look into is, what is their fee structure? I met a financial advisor a couple weeks ago, and they said they told clients, I don't know how I get paid because their disclosures are so long. Wow. So I hope that you find somebody that you are transparent with, that you feel comfortable with, that you're compatible with, but you also can trust. So you can pinpoint exactly where they're getting paid. Because if they're telling you they're getting, that it's free, that the service is free, unless they're working for a nonprofit, I doubt, even at a nonprofit, I doubt that your services are free. So be really careful. There's a lot of bad apples in the industry. That's why it's important as a caregiver. We don't have a lot of opportunities to make mistakes, unfortunately. So I hope you ask those questions. I hope that you can feel empowered to find someone that you're truly compatible with.
Such great advice. And I think, just with any kind of research you're doing in your caregiving role, interviewing a few different people, getting a feel for them, whether it's your financial advisor or a home care agency or a community that you may or may not want to live in, it's always good to have a few people that you look into or a few organizations just to make sure that you're doing your due diligence as a caregiver and making the best decision possible. And if you start ahead of time, kind of the lesson from our podcast today is start early, even if you feel like I don't need that yet. Start early so you have the luxury of time to do some of that research and uncover some of these resources that we've discussed today. So Danielle, we'll make sure to link to that article in our show notes along with your website so people can connect with you and continue to follow your work. But I'm very grateful that you've taken the time to share with us today and grateful that you're out there supporting family caregivers as they go along their caregiving journey and their financial journey. It is that niche that you mentioned, and we're just grateful that you're in the space.
Thank you.
A big thank you to Danielle Miura for joining me today and sharing such valuable insights. Financial planning isn't always easy to talk about, especially in the midst of caregiving. But Danielle reminds us that with the right support and a clear plan, we can move forward with confidence. To all of our caregivers listening, your role is incredibly important, and so is your financial well-being. Whether you're just beginning this journey or you're deep in the caregiving season, I hope today's conversation offered encouragement and clarity. If this episode resonated with you, please subscribe, leave a review, and share it with someone else who might benefit. And don't forget, you can always reach out to me at caregiverchats@homeinsteadinc.com. I'd love to hear your thoughts or future topic ideas. You can also follow us on social media at Home Instead Inc. for more caregiving resources and podcast updates. Thank you for listening, and please remember to take good care of yourself while you care for others. Caregiver Chats is brought to you by Home Instead. If you're looking for in-home care to support you on your caregiving journey, visit homeinstead.com to learn more.